Hello, I'm Dr. Katherine Nordal, Executive Director for Professional Practice at the American Psychological Association and its companion organization, the APA Practice Organization. I wanted to share with you today a quick overview of several of our advocacy initiatives designed to promote and protect the professional practice of psychology. The APA Practice Organization is a legally separate companion organization to the American Psychological Association. APAPO was created as a 501c6 organization to serve the professional interest of practicing psychologists and APA's practitioner members. The practice organization does not face many of the IRS restrictions, such as limits on lobbying, that apply to a C3 organization like the APA. During our annual State Leadership Conference in March of this year, psychology leaders from across the country attended a record number of visits with congressional members and their staff while advocating for the practice organization's top 3 legislative goals for 2013. First, we are advocating for fair Medicare reimbursement for the services that you provide for your patients. Secondly, we are working very hard to have psychologists included in the physician definition under Medicare. And third, we are working to make sure that psychologists are eligible to receive incentive payments to adopt electronic health records. Most practitioners are painfully aware of the downward spiral in Medicare and insurance reimbursement for the services that we deliver. On April 1st, Medicare reimbursement took another 2% cut as a result of the Budget Control Act of 2011, better known to us as sequestration. That decrease came on the heels of an average 2% decline in Medicare reimbursement for psychological services that resulted from the 2013 Medicare fee schedule that took effect in January of this year. Congress now finally seems serious about doing something about the issue of Medicare payment reform. One of the major factors influencing Medicare payment reform is the Sustainable Growth Rate problem, or the SGR. Recently, the Congressional Budget Office drastically reduced the estimated cost of repealing the SGR formula from $310 to $138 billion. This development seems to have opened a window of opportunity for the Congress to consider real alternatives now to the SGR. The practice organization has been invited by committees in both the House and Senate to provide input on Medicare reform proposals. You can read the letters we sent to the House Ways and Means and Energy and Commerce committees, as well as the Senate Finance Committee, in recent issues of our Practice Update e-newsletter. Back issues of this member newsletter can be seen on our APAPO homepage or Practice Central website at apapracticecentral.org. With regard to our second legislative priority, the Medicare physician definition, unnecessary requirements for physician supervision prevent psychologists in Medicare from providing the full range of services to our patients, the Medicare beneficiaries. On May 23rd, Senator Sherrod Brown, a Democrat from Ohio, introduced a bill in the Senate to include psychologists in the Medicare definition of physician, thereby removing inappropriate supervision requirements for psychologists. Senator Brown's bill is the companion bill to one introduced in the House by Democratic Representative Jan Schakowsky in February. APAPO has worked very hard to garner 23 bipartisan co-sponsors of this bill since it was introduced approximately 4 months ago. We are continuing to work hard to get more prospective co-sponsors for these bills in both the House and the Senate. Please visit our online Legislative Action Center at apapracticecentral.org to help advocate for this important legislation. And if you're on Twitter, please support the physician definition bill using hashtag PsychAccess and Senator Brown's Twitter handle at Senator Sherrod Brown. Our third legislative priority is to gain eligibility for incentive payments for the adoption of electronic health records for psychologists. EHR are the information infrastructure that will continue to be a major component of integrated health care and mental health service delivery. In order to position themselves to take advantage of emerging practice opportunities, psychologists will need to get on board with electronic health records. I also want to tell you about another very important development in our legislative advocacy arena and strategy. We recently formed a new political action committee, the APAPO-PAC. whose purpose is to support candidates for the U.S. Senate and House of Representatives who are friends of psychology. This new PAC is a vital element of our legislative advocacy strategy, so stay tuned for more information about APAPO-PAC. Healthcare reform is something certainly that all of our members are concerned about. The clock is ticking forward toward January 1, 2014, when key aspects of the healthcare reform law, known as the Affordable Care Act, will be implemented. Much of the hard work of healthcare reform implementation is taking place at the state level. And with that in mind, we have pursued a number of initiatives over the past 2 years to connect our state psychology leaders with the guidance and resources they need to advocate effectively at the state level around healthcare reform. I have personally participated in 15 separate healthcare reform summits hosted by our state psychological associations, focusing on ensuring psychology's inclusion in the evolving healthcare system. Meanwhile, through our articles in our Good Practice magazine and the Practice Update e-newsletter, we continue to educate you, our members, on developments such as the creation of health insurance exchanges, as well as new and emerging models of practice. As soon as the new Psychotherapy Codes for 2013 were announced last September, we immediately began building a new section on our Practice Central website at apapracticecentral.org/codes to help prepare members to use these new codes. Our online resources include crosswalks between the old and new codes, as well as answers to questions that psychologists frequently ask. Over the past 9 months, this section of our website has been viewed more than 500,000 times. Despite passage of the Mental Health Parity and Addiction Equity Act in 2008, and its expansion through the Affordable Care Act of 2010, we all know that parity issues continue to persist and impede patient access to psychological care. Since the interim final parity rule went into effect in February of 2010, APAPO has focused major efforts on the steep rate cuts and limitations on the delivery of psychological services. We, along with a dozen state psychological associations, have 6 parity rate cut complaints pending with federal and state agencies, starting with the Blue Cross Blue Shield of Florida complaint filed in October of 2011. Late in 2012, Aetna agreed to a proposed $120 million settlement in a class action lawsuit filed by psychologists and other health care professionals in New Jersey. APAPO supported the New Jersey Psychological Association, a named plaintiff in the case. As we've done with past class action lawsuit settlements, where our members were among the beneficiaries, APO will provide detailed guidance on how and when to submit claims as soon as relevant information becomes available. A major focus of our advocacy work in the marketplace arena involves confronting barriers to practice and opening up professional opportunities for psychologists. Millions of consumers are expected to move into the Medicaid system as a result of the Affordable Care Act's Medicare expansion. But several barriers to psychologist participation and reimbursement stand in our way. We are collaborating with several state psychological associations on various approaches to changing restrictive laws and policies governing Medicaid participation, and seeking to open up the program more fully to psychologists and the psychological services they deliver. The Affordable Care Act is also paving the way for large integrated practice models, such as accountable care organizations. So we're working with states, including New York and Connecticut, to change laws that bar psychologists from forming interdisciplinary practices with other healthcare professionals. We're also assisting interested psychologists in evaluating practice models that will allow them to participate in integrated healthcare delivery systems while still retaining their independent practice model. And we're joining forces with states such as South Carolina to gain legislation that opens doors for psychologists to participate more fully on hospital medical staffs. You, our APAPO members, are very important to us, as are your practice concerns. Every year, our practice staff takes calls and emails from more than 1,000 individual practitioners with a wide range of legal and regulatory questions and concerns. Some of the topics and issues we frequently help members with include HIPAA. We get a lot of questions about the release of patient information in light of the HIPAA privacy rule. We are completing our evaluation of the extensive HIPAA final rule released earlier this year and will provide further information and guidance to our members this summer. Another important area is record keeping. Increasingly, we assist members with questions about electronic health record keeping, ranging from basic information to more technical inquiries about record keeping systems. Typical questions on telehealth focus on reimbursement, informed consent, and practice across state lines. Dealing with response to subpoenas is a matter that has long been one of the most frequent questions that we get from members. We have extensive information about responding to subpoenas on our Practice Central website. Duty to warn, another issue. We've had an increased volume of calls in the wake of Newtown and other recent shootings. Psychologists typically want to know if duty to warn applies to particular private practice situations and what professional responsibilities they may face. The Physician Quality Reporting System is Medicare's quality reporting program that will shift from a bonus program currently to one that will impose penalties in 2015. And we continue to provide members with resources to get started in the program. Along with a dedicated section on our Practice Central website, look for the 4-page insert about the PQRS program in the June 2013 issue of Monitor on Psychology. This video highlights just a few examples of the work we're doing every day on behalf of practicing psychologists. Beyond our advocacy efforts related to the APA Practice Organization, we do considerable additional work for APA and its members. For example, educating consumers about psychologists and the value of psychological services, and engaging in the development of clinical practice guidelines. You can get information about any of the topics covered in this video and much more by visiting our Practice Central website at apapracticecentral.org. You can contact us by email at practice@apa.org or call our toll-free practitioner helpline at 1-800-374-2723. I hope that you have found the information on this video helpful. As always, I invite your comments and suggestions as we work together to support the future of professional practice. I also encourage you to follow me on Twitter at Dr. Nordal and the Practice Organization at APA Practice. Thank you so much for your continued membership in the Practice Organization and your support of all of the work that we do on behalf of the profession and the patients we serve.